Should a woman have a bone density test as part of her physical examination? Well, the answer to that question isn't as clear as the question might suggest. First of all, there are very few reasons for an otherwise healthy woman prior to menopause to have a bone density test. In fact, bone densitometry testing prior to the menopause often give false indications for treatment. Most of us who perform bone densitometry or who interpret bone densitometry testing would prefer not to have testing done prior to menopause. There are exceptions, and they're very specific. Women who are on medications known to cause loss of bone, or women who have diseases known to cause loss of bone. For example, those with kidney transplants who are taking high doses of medicine to prevent the rejection of their donor kidney definitely need to have bone densitometry testing. Women with rheumatoid arthritis, lupus, or other inflammatory diseases that either themselves or because they require high doses of steroid hormones, cortisone for example, also need bone densitometry testing prior to menopause. But in general, it's only the postmenopausal woman who needs a bone densitometry test. Recognize that bone densitometry testing is widely available, does not hurt, and involves a minimum of radiation. Now when you say radiation, everybody gets all upset and worried, but the radiation from a bone densitometry test is a small fraction of the radiation one gets from a mammography, something that most women don't think much about, and about the same amount of radiation that one gets just by being on the Earth at sea level over the course of a year. Remember, when you take a jet airplane, you get more radiation because you're closer to the sun. Somewhere 20 times more than you get from getting a bone densitometry test. Once you have a bone densitometry test after menopause, we compare you to the average 30-year-old woman. So don't be surprised if you're 50 or 55 and you don't compare all that well to the average 30-year-old. However, we're interested in just how badly you compare to that 30-year-old woman and whether your bones are stable compared to hers or you're losing. That's why sometimes your practitioner, your doctor, your healthcare professional may prefer to just watch what's happening to your bones rather than give you a treatment, particularly early after menopause. If it looks like you're actively losing bone, the situation is much different, where he or she may choose to give you an anti-resorptive medication, a medication that prevents further bone loss, and interrupt that cycle of loss in favor of cycling your bones to gain mass and increase their strength. This will overall reduce your risk of breaking a bone, a fracture. There are multiple medications available to prevent bone loss and to treat bone loss once you've had it, and those are the subject of other videos. There are many different women's health practitioners and professionals of different designations that take care of these problems. You might prefer to address the issue with your primary care doctor, or seek a specialist who happens to be expert on issues of sexual function or menopause or hormone therapy. If you have trouble finding someone to help, contact us at the website listed just below.